Hi, my name is Kimberly Bridgham and I am doing my NG insertion, irrigation, and removal. I will start with my pre-steps. I will check my physician's orders, check policy and procedures, gather my supplies, wash my hands, knock on my patient's door, introduce myself, check his wristband, have him state his name, his date of birth, check for allergies, explain the procedure, ask him if he has any questions, put my Chucks pad down, have a box of tissues ready and an M&S just in case. And I'll start by checking which nostril I should use, whichever one's better or has the most airflow. And I want to measure how long I have to insert the tube, and I do that by measuring from the tip of his nose to his earlobe down to the export process. Mark it with a piece of tape. Then I want to lubricant about 4 inches of the tube. I want to insert it about 4 inches or until he gags. Stop right there, hold on to the tube, don't let go of it. Give him a little break and a sip of water. And then we'll continue, and I'll say swallow, 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 until I can't go any further. And then I want to put my piece of tape on there that I cut in half, and just put one side of the tape down. And I want to make sure that I have it in the right location, and I do that by taking my 60 cc syringe and my stethoscope. I want to take the clamp off and insert about 5 to 10 cc's of air. Put my stethoscope in, and I want to listen for a swishing sound just a little to the left of the xiphoid process. And if no swishing sound occurs, I can aspirate 5 cc's and clamp it. Then I want to go over here to my pH strip to test what the pH content is. And if it is from 0 to 4, I know that I am in the right spot. So once that is good, I will also want to check to make sure there is no curling in his mouth. If you can open your mouth, please. And everything looks good. So at this time, I want to turn my, hook up my suctioning tube, turn on my machine, and then I want to make sure that the tube does not stick to his stomach lining. And I do that by inserting 5 to 10 cc's of air into the blue tube. Okay, and if everything looks good, I want to secure the tubing to his gown. I'll put a little piece of tape on there, and then I can get a pin and put on there. So everything looks good there. And a few minutes later, I come back and I see that his abdomen is distended and there's nothing in the tubes. So I know there must be a blockage. And I want to make sure I do a GI assessment, listen to all 4 quadrants to make sure there are bowel sounds. Okay. And I'm going to shut my suctioning off, shut the machine off. And then I'm going to check and see where, make sure I'm in the right area. I'm going to try to put 5 to 10 cc's of air in. I'm going to put my stethoscope by his fundus, and the air will not go in, and I can't aspirate any stomach content. So I know it is clogged. And what I'm going to do now is take my get a clean syringe and make sure I get 30 cc's of water, and I'm going to hold the tubing and the syringe in one hand and insert the water and pump, and I should be able to get it to go through, and I did. Okay, so that looks good. I'm going to turn my pump on, hook my tubes up, and I'm going to make sure that I put air, get a clean syringe, and put air in the blue tube to make sure it doesn't stick to the stomach lining. Okay, that looks good. Okay, and then a couple days later I come back and the physician has ordered it to be removed. So I am going to do my checks. I'm going to make sure I'm in the right location, get a clean syringe, put 5 to 10 cc's of air in. I'm listening by the fundus, listening for the swishing sound again, and I can aspirate 5 cc's and do another pH test on my pH strip, and I am in the 0 to 4 pH range, so I know I'm in the right location. And at this time I'm also going to have to do an irrigation, get a clean syringe, and I want 20 cc's of water and 20 cc's of air. I'm going to go over here, and in an upright motion I'm going to insert 20 cc's of water to get the bile out, and then the 20 cc's of air will get the water out. Oh, and I'll leave the syringe in, and at this time I'm going to remove the tube and I have my patient take a deep breath and hold it. Deep breath. I'm going to do a hand over hand motion, and after this I'm going to do oral care, and I'm going to go record and report, and also I need to record and report on the intake and outtake sheet. And that is it. Thank you.